Dr. Ghatan, dermatologist. Dr. Ghatan, does a dermatologist deal with spider veins and even some of those other ones which are not anymore spider veins but are much bigger?
Yes, we do deal with spider veins and some of the larger veins, reticular veins, or some of our colleagues deal with the varicose veins even. Nowadays, you're lucky to have technology that they can help the patients in office. A lot of times these things are done in office. We do the spider veins with injectables, inject solution that basically causes the vein to burn inside, and over time it just clears from the body. The results of that are partly immediate and partly take about 3 to 4 weeks to completely show the result. This is still a gold standard, the injection, sclerotherapy. Laser is also being used for treatment of the spider vein, but it's still the gold standard is sclerotherapy injection. The laser I think, is more useful for those tiny veins that cannot be injected with a needle. It's comfortable. It's not. It's a little bit. It's the needle trick, but it's not so bad. People tolerate it nicely and get good results.
Okay. Well, let me ask you: is there something a patient could perhaps do to avoid spider veins? Because that would be a good thing if it can be done.
Right. In some circumstances, yes. For the most part, people get spider veins or varicose veins because it has to do with genetic predispositions. The mother had it, and they haven't. It also has to do with pregnancies. During pregnancy, they are more prone to get spider veins. And also people working in jobs where they have to stand a lot. Those are the kind of things that can contribute to spider vein and varicose veins, etc. So avoiding standing position may be of some help. Avoiding pregnancy, I guess, if you want to do that, may be some help. But you can't do much about the genetic part of it.
Well, even about the other part, I know you're kind of slightly joking about it, because obviously ladies, in most cases, thanks God, do want to get pregnant. And what about if your job is, standing as a cashier in a restaurant or somewhere, and that's it. You have to stand. There's just nothing else you can do. So I got it. So basically, there's not much you can. Go ahead.
If you are prone to it and you already have some, then you can try to use some support stockings that may be of some help, and try to sit and elevate the leg as much as possible in between when you have a chance. That would be helpful.
All right. Regular exercise also of some help?
I'm not sure.
No,
it makes a big difference. No.
Okay, good.
Exercise is good.
Let's at least be thankful that to a very, very high degree they can be made disappear, and one can actually put on a bathing suit again. Yes or no?
Yes. And we tell the patients a lot of times they want to be able to go swimming in the summer, so we tell them to come a few months before the summer, because it's going to take some time for these spider veins to disappear. And you may need a few treatments over time, because if you have a lot of them, you want to just do a little bit at one time. So by the time the summer comes on, you'll be all set.
I see. So don't come a week before your vacation and then wonder why you're not ready.
Right.
All right. Thanks a lot, Dr. Ghatan.